Good morning, everyone. I'm Priluck, and today I'm going to talk about the effect of perioperative antibiotics on infection and failure in primary trabeculectomy. None of the authors have any financial disclosures to make. So I have several objectives today. What I want to talk about is whether the use of post-operative antibiotics after a primary trab alters the risk of infection and whether it alters the efficacy of the trab. So what I'm really trying to answer is that third bullet point, which is whether we should be prescribing post-operative antibiotics after primary trabeculectomy to begin with. So first, an introduction. There was a paper published looking at all of the endophthalmitis cases that occurred after a glaucoma surgery at Wilmer, and it turned out that all of them occurred when post-operative topical antibiotics were used. So we wanted to look back and really compare cases where antibiotics were used and weren't used, and wanted to see all infections, including blebitis, for example, beyond endophthalmitis. There really is no evidence that endophthalmitis is reduced if post-operative topical antibiotics are prescribed. There is, however, new evidence that intracameral moxifloxacin is useful. And there was also a multi-center case control study out of partially Wilmer, which showed that topical antibiotics increased the risk of late infection after trabeculectomy. So why might antibiotics actually be harmful? First, they can select for more pathogenic bacteria such as strep. They also decrease conjunctival flora diversity and can reduce the susceptibility of remaining bacteria to antibiotics. And why might the use of post-operative topical antibiotics actually affect the trabeculectomy itself? So, matrix metalloproteinase inhibition has been shown to suppress scar formation after rapid trabeculectomy, which results in a lower intraocular pressure. And similarly, MMP9 has been associated with leaking glaucoma filtering blebs when there's a higher expression of that protein. So the connection is that certain antibiotics like fluoroquinolones have been shown to induce the expression of certain matrix metalloproteinases, at least in the cornea. And so I thought there might be some connection between the antibiotics used and their effect on the local concentration of MMPs and then the resulting scarring in the trabeculectomy. So what do we actually analyze? We looked at all Wilmer primary trabeculectomies performed in the year 2015 and followed those cases for 1 year, and we also looked at all known endophthalmitis cases occurring after primary trabeculectomy from the years 2008 through 2017, for which surveillance data was available. For each patient, we collected their history of prior procedures and surgeries, as well as at their preoperative visit, their visual acuity, intraocular pressure in the operative eye, and goal of intraocular pressure for the operative eye, and then at 1 year of follow-up, their intraocular pressure and number of drops that they were taking to achieve that intraocular pressure at that time. We also included data from each trabeculectomy operative note, as well as tabulated the post-operative antibiotic choice and duration for each antibiotic, which was typically 1 week. And lastly, we looked at the rate of reoperation for each patient, which we equated with a failure, as well as the reason for the reoperation. So in total, 401 charts were reviewed, which was all the trabeculectomies performed in 2015, as well as a couple additional cases of known endophthalmitis after a primary trabeculectomy. 167 of these patients met the inclusion criteria, with 51 of the cases not using antibiotics and the remainder using them, and 234 didn't meet the inclusion criteria. Most commonly, that was because they were lost to follow-up. A lot of those patients came to Wilmer for the surgery and then followed with a local ophthalmologist after. Here we have the baseline characteristics of the antibiotic and no antibiotic groups, and you can see that the untreated IOP, the target IOP, the pre-op IOP, and the visual acuity at the preoperative visit are all the same essentially in both groups. Now getting at our outcomes, we found that there was no difference in the reoperation rate at 1 year for the no antibiotic and antibiotic groups. In fact, you can see that they were surprisingly exactly the same. However, when we look at the reasons for reoperation, they were actually different between the groups. For the no antibiotic group, over half of the reoperations were because of either hypotony or a leak, whereas in the antibiotic group, that only accounted for about 20% of the cases. You can see that over half the cases in the antibiotic group were actually to lower the IOP further, whether that was through needling, a tube, or revision of the blood to lower the IOP. For those that did not require reoperation, there was really no difference in the post-operative year 1 outcome in terms of intraocular pressure or the number of drops used. So you can see that both groups actually do quite well, and the number of drops used is quite minimal for both groups. As far as infections, 4 occurred within 1 year of surgery. We didn't find any that occurred outside of that time frame. All 4 had antibiotics prescribed post-operatively, and there were no infections in eyes without antibiotics prescribed after the surgery. The first case occurred at post-operative day 1, but ended up being culture negative and had a good visual outcome. The second case occurred at post-op week 3, which was culture positive for strep, and the patient ended up being NLP in that eye. Case 3 occurred at post-op week 5 and was positive for enterococcus from the tap and inject, and the patient ended up being hand motion at 1 year, but was baseline count fingers. And lastly, there was a case of phlebitis occurring at post-op month 11, which cleared and ultimately resulted in 20/20 vision. Ultimately, the difference in infection rate between the antibiotic and no antibiotic groups was not significant, however, because of the sample size. So in summary, when antibiotics are used or not used after a primary trabeculectomy, there's no difference in reoperation rates, at least at 1 year. There's no difference in IOP success. There do tend to be more reoperations for high IOP in the antibiotic group, and more reoperations for a low IOP or leak in the no antibiotic group. And then lastly, we found that all infections occurred in the first year in the antibiotic-treated eyes. Limitations include our sample size, and second, and most importantly, most of the non-antibiotic operations were performed by one surgeon, so surgeon technique was a confounding factor. I'd like to thank Dr. Quigley, who helped me with this project immensely and helped me analyze the data, as well as Drs. Jampel, Romelu, and McGlumphy, all of whom I've had discussions about this topic with and have helped me think about this idea as well.